So please go ahead and ask your questions. Yeah. Any questions on hair care?
Doctor, thank you for the good session. I had a question. Like the current generation, even young people, like we are losing hair at a very faster pace because of stress and hormonal imbalances, especially in women. And like some people are able to afford higher treatments like PRP and growth therapies and all of that, but not everybody will be able to afford it, right? To revive the hair back. So, what is your take on those kind of hair loss? These kind of hair losses can, as you know, will have huge psychological imbalance, like affecting the psychological, self-esteem and all of that, especially among young people. And I'm sure you would have come across these cases in your clinic as well. So, what is your take on that? How much can we save the hair and how much should we balance? Um, yeah.
Yeah, thanks, Angeline. It's a very valid question. First thing is, if it is just hair fall, like as I told you, the telogen hair, I showed the photograph of the telogen hair, where if I pull this, it will not fall, but if I do like this, it comes out, yeah? That is a dead hair. Normally, it should be 15%. If it goes to 50%, because in hair, your diagnosis is important. Generally, like during COVID also, very common was telogen effluvium. Before going to PRP or anything like that, first work on your diet. Think and eat proteins. Your protein requirement, if you're not having doing exercise, that is weight training, is 0.8 grams per kg body weight. So if you're an individual of around 50 kgs, you need to have 50 grams of protein. If you have one egg, it's only 6 grams, the full egg. So I always say, because many of the youngsters are not eating right. So, see to it that your diet has good amount of proteins, 1 or 2 eggs a day, dark green vegetables. Because when you go out, all that you get is carbs. One vada pav sandwich is like just carbs. So what your hair needs is proteins. Think and see to it that you have good proteins. Second thing is sleep. Many times, many of the youngsters, there is time to sleep. The sleep hours is between 12 to 4, because there's a hormone called as melatonin, which is released, which is now also available in the market. Yeah. So your sleep matters to your body and your head. That's why it's called a sleeping beauty, if you had heard of that. So prioritize sleeping between 12 to 5, because you sleep after 2, that hormone is not released. So sleep, diet, rest. Other than that, there are certain simple serums which are available. Nowadays there's Procapil, all these. You don't need to use minoxidil. This rosemary oil and all don't work. It's okay. It's not bad. But see to it that you use nowadays a lot of these peptides which have come, which are available in the market. See to it that you use these peptide lotions on the scalp. It helps in preventing. And any vitamins with biotin can be started. Yeah. But if the hair fall is really severe, I would recommend you meet a dermatologist. Why? Not necessarily PRP, but diagnosing the condition is important. Like today, I had a patient who had come from Mumra, and she had this severe type of, which is rare. It's a name called a pseudopelade, where it's something where your own body attacks your hair and the hair fall can be. So the different types of hair fall, what I'm trying to say is diet plays a good role. You eat, you can see your color of your hair getting better. I hope that helps.
Yeah.
PRP is something which is not, it's definitely helps add on to the hair fall, like to help prevent hair fall, but it's not the first go.
Right. Okay. Okay, Beulah, and then we will straight away go with take questions on the chat. Yeah. Okay, Beulah, please go ahead.
Yeah, thank you, Abhijit. Very good evening, Dr. Pramila. This is Beulah here from Hyderabad. My question is thank you for the detailed yet very crisp presentation. I've heard a lot about autoimmune disorders and genetic influence, heredity on hair loss. So much so that sometimes it passes on to the children, even uh, teenage kids or as young as 8, 9. We see them, their hair is graying and they tend to lose hair. So, and in the same family, maybe a sibling will have thicker hair, but someone, will just have a lot of shedding, hair fall at a very young age. So, how much of it is a factor like genetic influence? Especially the father is bald, is what they say. But in other families, because I've gone through that, but I've seen my friends whose dads were bald, but they didn't have any, they had in fact very thick hair. So, how much of it is a factor? I do know that stress is now the underlying factor for every illness, even cancer for that matter. But yeah, I'm a dentist, so I know a little bit about the background of it. So
Thanks,
it seems
Beulah.
to be a little
Yeah.
frightening. It seems to be frightening that even children now are prone to stress and hair fall as young as 8 and 9
Correct. You're
years.
right.
So
You're right, Beulah. Genetics do play a role, but I feel nowadays genetics do play a role. See, the thing is why I'm saying that is the male pattern hair loss that happens in your father or your mother also. Children don't get male pattern hair fall at such a young age. Male pattern hair fall is basically androgenic. It is hormone induced. So you will never see it before the puberty. Never. I'm sure of what I'm speaking. But generally in children, which I see nowadays having a lot of hair fall, is basically related to nutritional, very related to nutritional, because children don't eat right. Also
processed
have
food. Yeah.
processed food and not nutritional food, because nowadays there's so much of chips that they fill themselves. And I do suggest for children also starting vitamins and protein supplements because they don't eat well. Yeah. Now, whitening of the hair, you're right. It's much more common nowadays than it was 20 years back when we were not doing so economically well. Yeah. So water also plays a role. Certain hard water or certain things have chemicals that can trigger further whitening. But in children, when it is too much whitening of the hair, it's also good to do a B12 because vitamin B12, when it is on the lower side, tends to trigger these things. So not all children have autoimmune. It's a very rare thing for children to have autoimmune disease. But stress, there's something specifically called as alopecia areata. It is not an autoimmune condition. When you say autoimmune, we are talking about SLE. It's a different thing. Yes, or alopecia areata, where you see patches on the hair, is something which is a self-limiting condition. I wouldn't put it in a category autoimmune. It's one of a stress-related condition and it can be completely reversed. Yeah. So when it comes to treating children with hair thinning, male pattern or female pattern hair thinning is not so early. It is more commonly to do with diet, nutrition. Yeah. So one of the simple parameters that I do for my patients who are younger is simple CBC, that is to do with hemoglobin. It should be minimum 12. Vitamin D3, thyroid, and ferritin. When these are lower, treating that definitely helps.
Uh, there is curly girl products in the market. How safe are they? That's a
Yeah, they're
question
very
of.
safe. See, if you're using some products over or on the hair, they're basically the shaft. So they're quite okay. Avata and all are natural products. See, the stay-on products there's no problem using it. Whenever you're using stay-on products, see to it that you're using products to cleanse it also properly.
Okay. What can be done for receding in the front portion?
Yeah. So receding hair fall is basically a male or a female pattern hair thinning. Minoxidil is available, but just one thing doesn't work. You need a whole basket of treatment for that. And see, these are like brushing your teeth. You can't expect treatment in 3 months and then stop it. So understanding the type of hair fall that you're having. If you're having a male pattern hair fall and you're saying, am I going to use for 3 months? 3 to 4 months will bring your hair, but using the medicines regularly is important for keeping the hair also. So depends upon the hair fall that you're having, the treatment depends. Like if you say, till when do I have to brush my teeth? Till I want to have teeth. So if you're thinking of male pattern hair loss or a female pattern hair loss, treatment is long term. Once you get treatment, your maintenance is important, whether you do hair transplant also.
Which shampoo or conditioner brand would you suggest to prevent hair fall?
I'm really sorry. As a doctor, we are not supposed to do this because I'm not branding for anything. Shampoo conditioners are like soaps and moisturizers. Remember that. Okay. So, shampoo is something that will clean your scalp. A conditioner, that is something coat your hair. So, any of the products can be used depending upon your hair, whether it is dry hair, oily hair, or combined hair. So, these products are products which are for the texture of your hair, best advised by a salon person.
My daughter is 16 years and she suffers from dandruff issue. What health changes and or medical treatment to implement in this case?
Yeah, so I just had a talk on this on my Insta. If you want, there's a whole talk on that. If on Skin Plus Doctor, Skin Plus dr. You can share it. The thing is, why we need to understand this, dandruff is something which is hormonal. Yeah, it can be kept under control. If anybody says, dandruff do dala, that does not happen. So we can keep it under control. So using a anti-dandruff shampoo depends upon her scalp, whether it's a sensitive scalp, dry scalp, A good anti-dandruff shampoo 3 days a week, after your regular shampoo, that's a scalp concern, is important. Now, very good question you asked me is, what health changes need to be done? Now, dandruff is basically an increase in fungus which is on the scalp. It's not dry scalp, okay? And this fungus usually when you become a teenager, because of the normal hormonal changes, the fungus tends to touch on oily stuff on the scalp. So if your scalp is a little, are you able to hear me? Suddenly it became quiet, yeah. So if your scalp is a oily, sticky dandruff, very important in your diet to have dark green vegetables, have a lot of greens, avoid fried food, avoid too greasy food because the fungus can increase. Secondly, stress, dry weathers tend to trigger it. So use an anti-dandruff shampoo twice or thrice a week. A good one, any good branded one is good, but after your regular shampoo.
Okay. How to take care of frizzy hair?
Yeah. Now, frizzy hair is basically the texture of the hair which is dry and damaged. So important when you're having frizzy hair, use mild shampoos that will not make your hair more drier, and use leave-on serums as well as conditioners for frizzy hair to tame down the hair. Because as if you were there in my in the talk in the beginning, we showed you the cuticle. The cuticle is the outer part of the hair which has roofs. So what happens with frizzy hair? The cuticles are very open. So you need conditioners to basically coat them to make it less frizzy.
Okay. Some advice for changing shampoo frequently. Some people advise that one should change their shampoo frequently, but stick to a specific conditioner. What do you say about that, doctor?
No. See, these are they are products outside. So it's good to change your shampoo conditioner once in 2-3 months so that your hair, certain people don't mind it, but if it's not like it's good to change the products once in 3 to 4 months. Shampoo, as I told you, depending upon the weather. Now, when it is dry weather, the shampoos are different. In winter, it's different. Conditioners are leave-on. So more than conditioner, I like leave-on shampoos, leave-on conditioners because of the damages which the heat does. More than conditioners, I do like leave-on serums, which I have shared about. That helps in hydrating the scalp. Because now everybody, we want to have, we have ironing your hair, blow drying your hair. So all that will definitely make our hair more dehydrated. So it's important that we use conditioners and serums, yes. So I like to change my products and I do recommend, it's good. There's no harm.
All right. Any prevention for gray hair? Some say when you pluck your gray hair, it increases. It tends to. Is this
That's
true?
very interesting, Jess. That's very interesting, and I'm glad you brought it out. People even say that if you have a thick hair and you pluck it, you'll have 10 more coming. Again, these are all myths because I showed the root of the hair. When you pull one, how can you have two more? So whether you pull your hair, it doesn't come, and when you pull a white hair, it doesn't become more white. Yes, to some extent, when you have stress, there's something called as oxidative stress. What does that mean? There is chemicals that are released in the root of the hair that makes your hair white. So stress can definitely trigger whitening, but we see that also B12, like in the sense this vitamin, when it's a little lower, can actually aggravate it. So if you have too much of graying of the hair, also consider doing CBC, vitamin D and B12, that is B12. If it is lower, taking vitamins, I had a patient who had now she was in she's in her early 20s. So she came and said, Doctor, when I was small, I had come to you and I had white hair, now it got reversed. So in childhood, if you have white hair, it can be reversed with right medication. But if you're an older person in your 20s and 30s, it's less likely because of the stress, which is more. But there are lotions like, special lotions which contain certain products which can reverse if used for 4 months. Yes.
Yes. Okay. Is coloring hair uh, contribute to hair fall? Is it safe to do it frequently? What should be the frequency? Once a month, once a week? Yeah.
No, the thing is, coloring the hair may not cause hair fall, but it can cause brittling of the hair and more whitening of the hair. I know many patients will say, my hair's got white, I colored, then can now it get reversed. Once you color, whether it is minoxidil free, what is it called, ammonia free, all of them are chemicals. They do aggravate hair whitening. Yeah, so depends upon the hair color. Some of them can cause brittling of the hair, like certain products when you use they cause a lot of the hair becomes very dry and damaged, and because of that they can break. So more with the hair fall, it's breakage than hair fall. So that is important to understand. So when you're using hair colors, good to use good branded one that they don't make your hair more dry and brittle. And when you're doing hair therapy, hair coloring, see to that you use the shampoo conditioner. So you need to use good conditioners because otherwise the hair becomes more brittle.
Right. Uh, if premature graying is because of stress, is it reversible? Does
It
it
depends
get
upon the
when
age. It
stress is
depends
reversed?
upon the age. Very depends upon the age. Older people, as I told you, there are lotions that can be given, also vitamin supplements which can be given to some extent. In kids, I've seen many of them reverse. In kids, I feel the results are great. Older people, to some extent, like we can stop it. I've seen for that. Yes. See, there are no, I'm sorry, friends, but as a doctor, this is not legal. I know there's a lot of Insta thing where they put use this, use that, and people get a lot of likes. Why we don't do that is because we are not promoting any brand. Secondly, these are medications, they're not cosmetics. So it's always better, you take medications with doctor. Only in India we get medications over the counter. So when it comes to OTC product, the idea of OTC is over the counter, which the product is safe to take. When you talk about, I got a question over here for white hair, which products, etc. There's one Dabur ka product called as True Hair. That's an OTC product. You can use it, True Hair Oil. It helps to some extent. When it comes to medication, these are good to use it for a long term, which is something which is medicated, which I would recommend you visit your doctor for that. True Hair Oil is a Dabur oil product which helps to some extent. It is for hair growth.
Right. My son is 21 years of age. His hairline is receding rapidly. What should I do in order to promote hair growth and stop this receding?
I would personally say, visit your dermatologist because when it comes to hair thinning and hair fall, there are blood tests, vitamins, we can restore it. It takes 4 months to do it. Just taking minoxidil, and there are so many which are there. So minoxidil is one of the things does help it. But the thing is, when you use minoxidil, if he has any vitamin deficiency and that is not treated, then the hair fall is more. So when you're having a 21-year-old, he needs to be counseled first thing about his diet, his lifestyle, because just putting PRP, patients will come and tell me, doctor, do a PRP for me. And they don't take the basic diet, the nutrition. It's like you can do a filling of a cavity, but if you don't brushing your teeth, you're going to have new cavities. So what I'm trying to say, whether you're doing PRP or you're doing any of these transplants, your basic lifestyle modification, your lotions, your tablets are important, which are safe. There's a basket now. Everybody, why I'm only sharing this in this time? Everybody is becoming a dermatologist. I'm only sharing this is because with goodwill, go to a person who knows their stuff because this is what we study. Don't go to anybody and say that I burnt my hand. Take a proper consultation from a person who has experience as a dermatologist. Now we have Ayurvedic and everybody becoming that. There is treatment, but you need to understand we can bring it under control and keep it under control.
Right. Can serums and conditioner be used for kids?
A good question. Now it depends upon why you're using what you're using. Now kids means if it is they are less than 8 years, if they are going to the swimming pool. Now when you go to the swimming pool, the hair becomes very brittle. You can use serums on the hair. Shampoos, there are kid shampoos which are there. So there are special shampoos depending upon the age. I hope that is okay, or I don't understand the question beyond that. If you need more clarification, you can write it.
Okay. Do kids need conditioner after hair wash, and do they need oiling too, like adults, and how often?
Age of the kid, tell me please.
Okay, if you can clarify the age, whoever is asking, it will be good. Uh, okay, I'm going in order. Some of the questions come directly, so I'm guessing it's anonymous. So I'm going ahead and yeah. Okay, is it possible to give names of lotion for preventing of graying? Again, that is
True hair oil you can definitely use. It's an OTC product. True hair oil. TRU hair oil.
okay. True hair oil. Yeah. Okay. Thank you, Dr. Pramila, for the practical detailed talk on hair care. This
Thank
soothing
you.
voice
Most
of
welcome.
yours. Any home remedy or natural product like plant extract in the garden like aloe vera etc. good for dandruff as told by some?
Good question. Aloe vera is more hype than anything else. It's just a moisturizer. If your scalp is dry, you can use it. But when you have dandruff, use it with caution because sometimes some of these products, when you apply, can trigger it. So aloe vera is like a good natural moisturizer. But nowadays, there are meta products. Now, when it comes to hair fall, nowadays you would have seen of many of these brands which have rosemary, onions. These are basically certain things that stimulate further hair stimulation. So there's no harm to some extent. As a doctor, as a medical person, if you have something like a nice knife, why would you use a butter knife? So they are not bad in any way.
Correct, yeah. Yeah, I think in with reference to the
Yeah.
question asked earlier,
Yeah, so when a child is 10 years old is very different from the child who is 4 years old. For 4-year-old, you need to use paraben-free products, mild products. A 4-year-old child does not need a conditioner because the type of hair is different from a 10-year-old. Now, a 10-year-old is pre-pubertal, pre-teen. There is already sebaceous activity which are happening on the scalp. So a 10-year-old can use a regular shampoo, but a 4-year-old, absolutely no. Conditioner also not required because the shampoos which come are usually sulfate free and they come with conditioner which is there in that. Oiling basically is something which is our Indian culture. We like it, but it is not something directly affecting the quality of hair. Like my daughter is 11 years old and just for things, she has long hair. She has her hair almost till her butt. She has a very long hair. And as a child, I never shaved her hair. Okay. Because I know that is the thing. People think that when you shave the child's hair, the hair grows thicker. I didn't do it for my child because according to science it does. And my daughter has long hair. And yeah, you don't need to shave your hair for that.
okay.
Yeah.
What is the right frequency and time to oil one's hair?
As I said, oil is a moisturizer. If you want to do it once or twice a week. It hydrates. Personally, I don't like oil and I don't use it for my child. I use it usually for the sap as a leave-on conditioner.
Okay. I think we've come to the close of the questions, so please go ahead and ask your questions. Anybody's here for the first time and you'd
No, I
like to
like
get in touch with us?
Pastor Abhijit, I like this question, which is a very good question with one of
Yeah,
them
go ahead.
person wrote us was, hard water is a major concern in major cities. Is it better to use mineral water? This is a very good question because I have patients who come from some places where there is hard water. It's difficult to use drinking water, but there are some water softeners which are available. So I do recommend because when you have hard water, you notice your hair texture and the color also changes. So instead of using mineral water, there are some water softeners can be used for hair specifically. Yes, hard water definitely changes the texture of the hair and sometimes it can trigger hair fall. Yes. I just thought I'll answer that because it's a very interesting thing. There are water softeners which are, you can add it to the water, keep it for some time and then use it for the hair.
Okay. Yeah, thank you very much for the useful session. There's an appreciation. Hard water is so hard that it spoils the softener too. Okay. I don't know what to say. Okay, Dr. Pramila, would you put your Insta account or whatever on the
Yes.
chat in case people want to be in touch with you
Yes.
through your social media or
Yes.
professional account? It would be nice. Yeah. Any other question, please ask. We are, we can
Um,
close.
may I,
Yeah,
Dr.
yes. Go
Pastor?
ahead. Yeah.
Yeah, I have asked this question earlier, like the frizzy hair. How should we take care of the frizzy hair? My daughter has a frizzy hair. She is 10 years old. That's the reason I have asked a connecting question whether it is safe to use serums and conditioners
Yes,
on
yes, yes.
that
See, for a
age.
10-year-old, when there is hormonal that changes that are happening, that itself changes the texture of the hair. Yeah. So for a 10-year-old, you can use serums for sure. Definitely you can use serum and see to it that her diet has a lot of dark green vegetables because of the hormone. And for 10-year-old, you need to use when they have frizzy hair, proper shampoo conditioner for dry damaged hair. Yeah. For 10-year-old is very safe because 10-year-old, they are getting into teens and because of the hormonal changes, they can use regular products. As I told you, a 10-year-old is different from a 4-year-old or a 2-year-old, completely different products. Yeah.
Yeah, thank you.
Yeah, most welcome. She can use any of the products which are there. It will really help. For frizzy hair at this age, because they are in school, you can even use oil, not on the scalp, but the hair to, tie it and keep because that helps prevent the frizziness.
Oh, okay. That's helpful. Thank you so much.
Any other question anybody would like to unmute and ask, go ahead, or put it on the direct chat to me or doctor, or you could put it on the open chat also. Unmute and ask. Yeah, thank you, Mr. Yogesh. Yeah. Any question? Doctor, one of the thing we had seen a popular Bollywood actor was male actor was losing his hair till he suddenly appears in one movie with thick hair. So, is there something for men who have lost their hair? Is there some kind of
So
technology?
nowadays, yes, nowadays hair transplant has become as common as an cataract surgery. So
Oh,
hair transplant is where we take hair from here and then we implant it over here. So more now, before they used to use wigs, which are called as weaving. Weaving is where you have a patch of a wig to put, yeah. But nowadays, more commonly is transplant. So transplant has become very, very common where they take the hair and put it over here. Now we need to understand when you do transplant, it's like grafting. You're grafting the hair. So when you're grafting the hair, it's important to understand the hair that is existing still needs to be nurtured. Yeah. So the difference between a grafting of transplant as well as a PRP is like giving, proteins into the root of the hair. It's like manure. So there's a difference between when you do PRP, it's just thickening the existing hair. You're not having new hair with that.
right. Okay. Thank you. Yeah. Any other question? Yeah. So, what's the? Sometimes there are pretty young people losing their hair or it starts graying, and often they don't know if it's the right age to seek help. Also, some people assume that okay, my age is up now. Maybe it's just natural part of my. So, what age can one still strive to save their hair, or then look at it as a natural thing? What's
Whitening or hair fall?
both, if you could. Yeah.
So you can have hair fall if you have at say 50 also you can have like if 40 or 50 also you can expect new growth. It's about
Okay.
maintenance depending upon the stage of hair growth. Like if you have a male pattern hair loss, there's grade 1 to grade 8. Grade 8 is where you have only hair. So if you're in grade 3, grade 4 and you want to have hair, you can still have because with medication, there are oral medication. When it comes to whitening of the hair, whitening is graying of the hair, sorry. Young children do best. Older children, older people, the problem is when it becomes too much, the products are very expensive. The results are not very great. Why I'm saying all these over-the-counter products, when people ask, it's minimum 1200 for a 300 grams thing. It's expensive. So when you're investing some that you better know that is the right treatment to do. So for whitening of the graying of the hair, important for us to do the vitamin test. And if they're all positive, like all are normal, then as I told you, when it comes to graying, in your till your 20s, it's doable. I think you can have reversal. I have not seen great results beyond 30, 40. When it is adult type, not very great results is what I have seen. But
Okay.
male pattern, yes, you can have hair growth much older also. I have like literally, I have women also who have thinning of the hair. There are hormone medicines that can be used and you can have maintenance and improvement.
Right. Right. Okay. Any question? GFC is better than
Yeah,
PR.
GFC is definitely better. PRP is something which is called as plasma-rich platelet, which I've been doing it since 2006. GFC is growth factors which are triggered, taken from the PRP. So definitely growth factors are much better than applying just a plasma on the scalp.
Okay. Anyone else? Any question? Yeah. Thank you, Dr. Pramila. You did such a fantastic job, and you spoke with so much ease and with so much authority. Also, we would have asked you to do a session on skincare also immediately, but it's better to meet once again after a while and reconnect. For everyone's benefit. Thank you so much. God bless you for joining with us. Good night, everyone. Bye. Thank you.
Nice. Thank you, doctor. Thank you so much.